eat the little fish. And the Federal Trade Commission says, wait a minute, that can't be. That's a monopoly. You're going to deprive those people of the opportunity of a choice. The same exact thing when airlines or telephone companies are doing it. So that was tried in a court, and the court said, no, that's not a problem. That purchase can go through. But that's getting ready to be heard in the Supreme Court, because the question is raised, will that monopolize those people's choice? And I wonder if that doesn't have a little bit of reflection on what we're dealing with here. Who is driving this ship is really the question that I think you should have. And I'm so happy that you're here. And if you leave here without committing to take this to the next step, we've made a mistake here, and you've made a mistake there. This is our last hurrah. We have failed as physicians to affect any change, significant change. We really have failed. And the only way I think this will change will be if you folks walk out there after this and say, I am interested in making a change. I'm interested in trying to help. But if you walk by those tables and don't do that, I doubt much will change. I really doubt it. But, a public forum, what is the problem with that? The last one I remember, I saw Mike McCandless at Subway on Sunday. And the last public forum I remember here was with Bill James and Mike McCandless in the Chamber of Commerce at the old Holiday Inn. Must have been 25 years ago. I hadn't been here very long. And they were interested in something that Lee and Philip Rutledge and I were interested in. We were interested in the YMCA. They were interested in a year-round recreational facility. Thought it'd be good for the community. On top of that hill sits that product. It's a good thing. It wasn't a bad thing come of it. And something good can come from this if you take it to the next step. I wrote a letter to the hospital board last Wednesday, and in that told them that I'm reassuring you. It's 6 sentences, one of which says, I intend to reassure you. We certainly mean no harm. We intend to make things better. I have to believe that you're interested in the questions of this community. But we're taking a few hits for trying to help you. And that goes with the deal, I guess. But I think it was a mistake, when they changed the name of that from T.J. Samson Community Hospital. I thought it might have been a figurative thing, but it looks like it may have been a literal thing to me. I do think there's a huge need for some transparency. I would say the majority of you have no idea the things that have gone on, the pressures that are put on people there. I'm sure you have no idea. I think there needs to be some sensitivity. And there are crazy things that I think each of you would agree with, that scenarios that I think help clarify what I mean by sensitivity. I think they have to stop pitting doctor against doctor. I mean, we are sort of comrades and have always been. And I already said I don't take issue whatsoever with people making a decision for whom to work. That's a decision that is their business. But we're put in an odd spot. We're put on committees. The committees are asked to take away voting rights of this person or that person. Crazy things that probably could have been avoided. I think there needs to be some sensitivity in respect to those people who really help get you to where you are. I mean, I saw Jim Whiteside here. He came here, I don't know when he came came here. Could have gone somewhere else, but chose to come home. He's the daddy of the cardiology here. I mean, he really is. That was a great, great deal for this community. And we've had other people that came here. I guess Orlando Bravo was the first person to do OB that was a OB specialist. And you hate to start mentioning people because you leave out lots of people, but those people deserve, I think, some respect. And they got, the people that helped get the hospital to where it is, got it there by a couple of things. One is they earned the hospital a reputation by their availability, by their product, if you will. And the second thing is they earned the hospital a lot of dollars that could be used very positively. But it appears to me that some of those dollars are being used like bricks in a pillowcase. And it's a little bit threatening, I think. And you should be threatened by it. There are a couple of stories that I think typify some of that. There's B motive. I've been here for 33 years, delivered about 5,000 babies. So she finds out walking down the hall, overhearing someone say that they have hired someone to do what she does. To me, that's not really nice. I think that was poorly handled. And I don't mean to come in on one isolated event. But picture, if you will, a 30-year-old person that gets out of their training. They shop around for a job opportunity. They decide they're coming to Glasgow, Kentucky. They borrow a sack of dollars and buy a house. They plug their children into school. They're working hard, and a couple of years later, they're going to buy an office or build one. And then, 2 years later, they walk down the hall and find out that the institution for whom they are bringing patients has hired someone that does what they do. I don't know how that would make you feel, but I kind of do know how it would make you feel. It'd make you feel like going home and starting to put some of your things in a box emotionally. And you can't blame someone for feeling like that. I know everybody says medicine's changed. I would agree with that. It's not a great industry. I like all parts of it, but it's not a great industry to encourage your child to go into this. There's so much uncertainty. But some of those things can be handled a little more tactfully, I think, than they have been. I think we really need to help identify some of the shareholders to whom this board is responsible. And I think that's the essence, really, of what we're dealing with here. You know, I was thinking coming out here, what makes a good doctor? And you gotta have a little knowledge, need a little dedication, need a little compassion, need a little experience. But one thing that I think is good to have is someone who has the ability to recognize when things are going poorly early in the game. I mean, anybody can walk in when things are just a disaster. But somebody, you're lucky to have one if they can detect something bad is going on early. And I think all of you tonight, or most of you tonight, know there's something not quite right going on here. You could probably help individually, but I think you won't help as much individually as if you group together. And as I say, we have failed. We have tried, but we have failed in trying to group together. We've gotten a lot of condemnation. We've had some manipulative things happen where we're ostracized and put at a point where we really can't make a difference. relationships for you. But I think collectively you can make a difference. But you'll have to do it collectively. I hope you will. We're going to try to look at some of these questions and try to give you some answers. We have to be very careful to not misspeak. We have to be careful to tell you that some of these, or pretty near everything we answered, should be prefaced by, in my opinion, in my experience, or these are the things that I have seen. We have to be very careful, and I'm sure you understand that. But I think a hospital board has the ability and the responsibility to make those needed changes. And I told them in that letter that I mentioned that I have to believe they care about what you think. I just don't think you've had an opportunity to gather together and say we are concerned. But thank you all for coming.
The questions have been categorized, but some of them overlap as we go through, so we may duplicate some, so just bear with us. We will not be able to cover them all, I don't believe, but we're going to attempt to. Okay, starting off, the first question, are references required from the doctor candidate other than a referral from the company providing the doctor candidates and the name of the company?
I guess that would be addressing the hospital's program, probably. I think they have to go through an interview process. I don't have a lot of personal knowledge about that, just what I've read about the hospital's programs. They do go through some rigors. They have some requirements for board eligibility or board certification. And although I've not seen those references, we've not been shown those references, I believe they probably are requested.
I think that's a hospital striking a business agreement with an entity that supplies physicians that work in that capacity. I think I'm speaking correctly. That's not the hospital striking a deal with this hospitalist and that hospitalist and that hospitalist. I think they strike a deal with an organization who employs doctors and puts them in hospitals that want hospitalist program.
And our local hospitalist program is APEGE, A-P-E-O-G-E-E, I think.
Okay, the next question. Question that refers to language barriers. I'm not going to read it as per, but what kind of help does the hospital give for the language, sometimes transferring information from the doctor to the patient? Is there some kind of program that helps with that?
They have translators that are available, I don't know for every language, but I know they have translators that they can call if a patient's in the emergency room or a surgical patient. I think that's what they're referring to.
Patient would just need to request it.
I think you're right.
Why pay primary doctor when he does not come to the hospital, and why can they not visit? So that's a follow-up on that.
Well, I think there needs to be a little clarification on that. Now, primary care guys are in an equally tough spot. They have to make a decision. Are they going to stay at the hospital and make rounds all morning and then show up at their office at 9:30 when you may have been there since 8:30 waiting on them? Or are they going to try to say, I can serve your needs better by being here at the office, and I'm going to let somebody else take care of you at the hospital? But that is a trend. That is a national trend.